Welcome to another edition of Columbia University's What is Global Health podcast. For over 20 years, Dr. Unni Karunakara has been a humanitarian worker and a public health professional. Dr. Unni has initiated healthcare projects for people affected by epidemics, disasters, conflict, and neglect in Africa, Asia, and the Americas. He has served as the former international president of Doctors Without Borders, Senior Fellow of the Jackson Institute for Global Affairs at Yale University, Assistant Clinical Professor at the Mailman School of Public Health at Columbia University, and is a visiting professor at Manipal University. When and why did you determine that public health was what you wanted to pursue as a career? And what made you decide to take on global initiatives?
Thank you very much for having me. It's always a pleasure. I was a medical student in India and in a very traditional sort of medical education, which is almost always focused on the biomedical determinants of health. And after I studied medicine, I was on my way to become a radiologist when I decided to take some time off to study public health. In India, the education system is such that you have to choose very early on at school whether you want to be studying science or whether you want to study social sciences or the arts. So I had chosen science. But I always felt that there was a big hole or a big gap in my education. And when I started studying public health, I realized that it was the perfect bridge between the sciences and the social sciences. So suddenly there was a revelation or a light bulb moment for me where I realized that medicine really has very little to do with health. It is it deals with illness and disease, but um, uh, in order to understand health or in order to bring about change in uh, health and well-being for people, it was necessary to understand the social and political determinants of health. And of course, it sort of got me hooked, and I never went back to radiology. And there started my career in public health. So where I did my master's degree in public health at Yale University, and right after graduation, in fact, even before graduation, I wasn't there for graduation. I went to Ethiopia with Doctors Without Borders. Initially, I thought I would go for a year. I was very excited about working in Africa. You know, a young student, um, um, sort of very excited about traveling. But I think it's fair to say that that year changed my life. What I saw and what I experienced made it almost impossible for me to practice or be a healthcare professional in any other way. So, well, that's how it was in '95 that I started a career, if you want to call it that. My engagement in on global health issues started in 1995.
Can you talk about your time as the former international president of MSF and what were its missions during that time and what projects did you work on?
So, 1995, I went to Ethiopia with Doctors Without Borders, and I kept going back. And I want to underline here, I never saw humanitarian work as a career. It was something that I was compelled to do. I kept feeling that I could best contribute in these places where people had very little access to quality healthcare. And through Doctors Without Borders, I was part of teams that were bringing reasonably good quality care to people who had none. So over the years, I took on more responsibility in the organization, and in 2010, I was elected um, as the president of Doctors Without Borders. Needless to say, it was a great honor and privilege, uh, but nothing really prepared me for not managing, but at least being a head of an organization with 45,000 people in more than 100 countries around the world. It was a real important time in my life where I began to see the promises of global health, but also the limits of humanitarian assistance, also development assistance in these countries. Some of the big issues during that time, there was what was called a nutritional crisis. Some people called it a famine in Somalia during that time. Uh, the 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 conflicts in the Middle East got started around then, um, and there were a lot of other internal challenges for an organization that was really growing, really big such a short time. There were internal challenges as well. We had to um, organize the organization in a way that it could respond to all of the challenges that we were facing in countries around the world. So, of course, it's not just me as a president responsible for all of these. We have a fantastic team. We have a really flat organizational structure where we have really autonomous decision making in many places around the world. So it makes it easier for the organization to quickly respond to emergencies as and when they arise. And my job as president and as chair of the board that oversaw the organization was to ensure that we were implementing programs in a principled manner. So that took a lot of my time, and of course, I traveled far and wide to the countries where we had operations, seeing firsthand some of the challenges, while also interacting with the people in the NSF teams, but also a lot of the people that we had to work with in these countries, we engage with in these countries to jointly provide the assistance for the people. And as face of the organization, I was also responsible for representing the organization in international fora with heads of states, other heads of agencies, and also to the media and to the press. So incredible period, incredible honor for me as well. But it was also a period, like I guess all periods are, of big global health challenges.
I understand that your work has also incorporated a collaborative process, as you've just touched on as well. Can you speak on the team building aspects that go into global health projects abroad and in research?
Um, Humanitarian agencies, I have to tell you, are not very good collaborating with people. I think part of it is a culture that sort of is emergency in nature, short term in approach. So you go into countries, very often systems are broken down. The people with the experiences and the capacities to be able to deliver services in countries are often not there. So you go in and you figure out how to provide assistance. But very often that's also used as an excuse not to engage with local communities and local people in places where we work. And I think over the years as an organization, we are realizing that we have to work with that. An emergency, short term, or a crisis, not an excuse for us not to seek out and to engage with people. Very often are the first responders. So, for example, in Syria today, yes, there are humanitarian agencies providing assistance, but I think I can safely say that the largest amount of assistance is being provided by Syrian healthcare professionals who take incredible risk in providing care. So it's also uh, it's not just a nice thing; it's a responsibility, so to speak, for us to engage with these people and help them in sort of jointly meet the challenges the situation poses. So collaboration is our thinking and our experience collaborating with and it can be um, very grassroots community organizations. It could be in some cases with the Ministry of Health. It could be in some cases with universities. So these are all we are learning as we're going, and we hope. And I think the future of humanitarian assistance, as you look forward, you cannot not collaborate. And I think this is something that we need to continue to do in the future.
Can you talk about the research that you have recently put out or have been working on?
So I finished my term as president in 2013, and since then I've been an academic. And in the last year, we've been working on a project looking at the role of religion in ensuring or promoting social justice for refugees in different parts of the world. So our project currently is looking at refugees in Malaysia, in Greece, in Lebanon, um, in Cameroon, but also in the US at the southern border. And we're looking at how faith based organizations are um, providing assistance and how they use faith as a way to do that, and how the refugees or how the migrants experience that assistance. So this is a project that we are working on. We hope to have some early results by within a few months, and yeah, so we're quite excited by it. And as you can see, the it takes a lot of um, different people and different organizations, different agencies to come together to meet the challenges of today. It's not just on humanitarian organizations to provide humanitarian assistance. Assistance can be provided by anyone. But humanitarian assistance is quite specific in the sense that it is independent, impartial, neutral, etc. And it particularly in areas affected by conflict, I think humanitarian assistance serves a particular. I think it's essential, it's necessary, and it needs it meets the needs of people who live in extreme crisis situations.
In understanding that your work demands a lot of traveling and global pursuits, why did you choose to then become a professor and teach in an academic setting?
Um, this was something that I was on my way to become before I started engaging on global health issues. So before in '95, before I went to Ethiopia with Doctors Without Borders, I had already I had wanted to be an academic. So I'm coming back to academia, let's say after 25 years. So it is, in that sense, it's always been um, the destination, so to speak. But more practically, I think you are a better global health practitioner because if you are an academic, because you have a certain so academic bent of mind, you approach global health problems that you face in the field with a certain rigor, scientific rigor. You are able to carry out operational research that is necessary to provide you with the answers necessary to implement your program in a more effective way. On the other hand, you're also a better teacher because you've had experiences in the field. So you're not just giving lectures on global health theory, but it is informed by your experiences, and you can, I think, you become a better teacher. So I always thought that it was a really great combination of being a practitioner and a teacher, and that sort of benefited me because every time I came back to a university setting, engaging with students and other faculty, sort of I learnt a lot. But on the other hand, I also hope that students learn a lot from me because I am sort of engaged in issues in the field. Um, you know, current. I've had extensive experiences in the field, so I hope that's a benefit to students as well.
How do you suggest the new age of future world leaders begin working in the field of public health? Where does one start?
I think you can start anywhere. Uh, you don't have to get on a plane and go to Africa to be a humanitarian. Just look around you in New York City. I mean, there are a lot of people living in crises. It is your humanitarian impulse that matters, and you can realize that anywhere. So start where you are, be open. The most important thing is to engage, um, and and you can do that here. And sometimes it'll take you abroad. It'll be a global health carrier. And one thing to understand, and it's quite important, that global health does not mean health that happens outside America. America is also part of the globe, right? So it is a certain way of looking at health and the prism through which you um, look at, formulate, and find proposed solutions. That's what matters. And I think you can be a humanitarian here in New York City, but you can also be a humanitarian in other parts of the world. Uh, Another thing is when I was growing up and when I finished my medical studies and when I started engaging in global health issues, the issues that we thought were important may not be the issues that students now think are important. In my time, this was in the early 90s, mid 90s, we had the highest number of conflicts since World War II. There were many civil wars going on in Africa, so everybody rushed to Africa. I'm not saying it's good or bad, but that's where a lot of people chose to express their humanitarian impulse because there were a lot of people suffering. TV screens were full of images of refugees and of children affected by famine. Today, one critical issue would be climate change because it affects not just people out there, it also affects people here at home. So I think students have to open their eyes and they have to use their own minds to decide how they want to engage. But the important thing is to engage because I think not engaging is not an option.
Moving forward, what are your hopes for the new generation in continuing the practices that you and your colleagues have initiated in humanitarian aid?
I think, given the state of the world today, what really gives me a lot of sleepless nights is we live in a world today where, unfortunately, leaders, many political leaders, um, lack the vision to create a unifying sort of. Their vision is not unifying. It's actually divisive. Um, Nationalist leaders, populist leaders, they achieve their objectives or they achieve their legitimacy by dividing people but not unifying them. And that, of course, you can see what the problems that causes. So, unfortunately, humanitarian agencies will exist for many, many years to come as there are more and more people who feel excluded from the economy. Inequity is growing. The wealth is being consolidated in I don't want to use the word 1%, but some people have more access to wealth than most people. So these are all issues that if we don't address, then we will have to respond. Civil society will have to respond and take actions that the government is unable or unwilling to do. So that's the power of having a global civil society that expresses solidarity with each other, It doesn't matter. The boundaries don't matter. Your citizenship doesn't matter. But you express solidarity with someone else just because they're human beings. And it doesn't matter whether you're black, brown, or white. It doesn't matter whether you're a Christian, a Jew, a Muslim, or a Hindu. It doesn't matter um, whether you are straight or gay. So these are things, and that's precisely what humanitarian action is. You see the humanity in people, and you believe that human beings deserve to live a life of respect and dignity. Yeah? So governments, unfortunately, are not key, have not shown the political will to create that unifying vision for humanity. So I think it's up to us, students, humanitarians, etc., to come together and do that.
In present day society, there has been an increasing crisis surrounding the ethical dilemma concerning humanitarian work abroad and impeding on local shores, like refugees or epidemics. Can you talk about in what direction you see humanitarian action moving towards?
I think, as I said earlier, humanitarian action is all about the shared humanity. It doesn't seek to divide people on the base of their citizenship, on their race, or their political sort of beliefs. So, well, I mean, why are there so many migrants looking to leave countries? So we have to really answer some fundamental questions about how governments operate, how corporations operate. Why are so many people not benefiting from the wealth that is being generated globally? And these are all reasons why people leave. And then, of course, climate change. So there are multifactorial, the reasons are multifactorial why people leave in such large numbers. Now, in the Universal Declaration of Human Rights, it's absolutely clear that people have the right to move and seek asylum. What we see today is governments are erecting policies and walls that prevent people from being able to seek asylum. And this just goes against the spirit of the Universal Declaration of Human Rights. So unfortunately, we live in the age of security. And in the age of security, human right concerns are almost always trampled upon and given secondary importance. And we need to bring that back. We need to put the respect and dignity of human being first and foremost before we start talking about security. And security is not just about national border security, it's also about human security, right? And that is also a shift uh, that we need to make. The policy leaders need to make as well. So there's a lot of work to be done, and I think global health and students of global health are um, they have a vantage point from where they can engage, where they can be part of conversations, propose solutions, and really affect change in the years to come.
Thank you again, Dr. Uni, for joining us on this podcast. It was so nice meeting you and so nice to hear what you had to say about global health and your career so far. Thank you.
Thank you for inviting me.